Thanks, Cian Corlett. I'd like to ask the Minister for Health the criteria for appointments to senior hospital management positions and board appointments in each of the hospital groups. What is the process, Minister? Are all the senior executive positions within the groups publicly advertised with interviews, and are all board appointments to these hospital groups publicly advertised for? Thank you.
Thank you, Minister.
I want to thank Deputy Chambers for his question. As I've stated previously, I intend to continue to implement the hospital group structures, but I intend to do so on an administrative basis. And the reason I'm doing that is because I asked this House to establish an Oireachtas all-party committee to develop a single long-term vision for healthcare over a 10-year period. It's very important that these discussions are progressed before I give further consideration to the issue of establishing hospital groups on a legislative basis. I think it would be disingenuous to move ahead with that while that committee is doing the work. In relation to senior hospital management positions, the HSE has developed eligibility criteria for senior management posts at hospital group and at individual HSE hospital level. The criteria reflect the particular experience, knowledge and qualifications required for specific posts and public sector recruitment policies applying to the filling of such posts. In relation to the hospital group board appointments, chairs, as the Deputy knows, are in place for all hospital groups, and board members were appointed to 3 out of the 7 hospital groups: the Sálta University Healthcare Group, the UL Hospital Group and the Children's Hospital Group. The terms of office of the Sálta University Healthcare Group and the UL Hospital Group boards are shortly due to expire. Given the scale of the change process involved in implementing hospital groups, the hospital group boards must be populated with individuals with the expertise and competencies necessary to deliver on the strategic and change management agenda. My department will shortly advertise through the public appointment service process for nominees to all of the hospital group boards, excluding the Children's Hospital Group, and I expect to be in a position to fully populate all of those boards in the autumn, around the end of September. All of those boards' appointments will be done through the public appointment service. I think that's very important that they're done in that way in relation to transparency. I do think there's benefit in populating the boards, even on an administrative basis. I think there's a body of work that can be done in terms of strategic planning for the hospital groups, and I do think that efforts could, that the areas could benefit from that. So I do intend to populate them, and I do intend to use the public appointment service.
Thank you, Minister. Deputy Chambers.
Thank you, Minister. I asked you about the process of appointments, and you outlined eligibility criteria, but you didn't give to me a transparent process and how it's outlined. And I think what we're seeing within hospital management is a complete replication of the same management who were in hospitals to senior executive and chief executive management positions within the hospital groups. And let me give examples. We've one CEO of a group was a CEO of a main hospital, then they became an executive of the HSE, and then guess what? They became the chief executive officer of the group. Another was a director of nursing at one large hospital, became the acting CEO of a hospital, then became the de facto CEO of the hospital, and is now CEO of the hospital group. Another was deputy CEO of a hospital, then they became CEO of another hospital, and guess what, Cian Corlett? They're now CEO of a hospital group. Where is the transparency around the appointments to these hospital groups? It's a very important process of reform, and apart from mentioning eligibility criteria, you have not outlined, Minister, how your government or the previous government delivered a transparent process of recruitment within the managerial side of our hospital groups, and I think you need to clarify the matter.
Thank you, Deputy Minister.
Yeah, thank you, Cian Corlett. Deputy, I'm accountable to this House for the decisions that I've made in my time as Minister for Health, and that's what I was endeavouring to do in my outline, in my initial answer to your question, outlining to you my philosophy and my principled objective in terms of how I intend to populate the hospital group boards, which aren't currently populated. And I want to assure this House and assure you that nobody will sit on a hospital group board, or nobody will be appointed to a hospital group board by me who has not come through the public appointment system. I think that's important. You are, though, I think you raise a very valid point, actually, though, in relation to the appointment of senior hospital positions. And as you're probably aware of the history, there was a government decision back on the 14th of May 2013 in relation to the reorganisation of public hospitals into hospital groups, and sanction of that was conveyed to the HSE in July 2013, and as you are aware, there was an urgent request from the HSE in August of 2014 to reassign senior managers from within the health service to the hospital group CEO posts, and that was done on the grounds of exceptional circumstances and with the agreement of the Department of Public Expenditure and Reform. It was also done on the basis, considering the financial situation the country found itself in, that these proposals would not result in any additional senior posts within the health service. The department also agreed that the individuals will be assigned to these posts for a period of up to 24 months in this first instance. So this issue will be arising again, and it will be up to me to develop policy in terms of how we want to go forward.
The issue, Minister, is you've mentioned exceptional circumstances, but the issue is that those same chief executives have moved into as chief executives of the groups. Then their positions within the hospitals have to be filled, so a hospital senior executive manager has to move from another place. And I think what we're seeing here in our health service is a de facto locum system for managers. It's a managerial merry-go-round, it's a cosy cartel, it's insiders in senior executive hospital positions moving around, rotating around, and if we ran our hospitals as the managers are moving around, we'd be in complete chaos. It's the equivalent of consultants rotating around to different hospitals every year, senior clinicians, and they can't implement change management. And what we have is a system of managers changing, but no strategic change within our health service. And I'd urge you to investigate and explore the actual rotation of managers within senior executive positions in our health service. It's not transparent, despite the exceptional circumstances, and I don't accept the point around the eligibility criteria. And I urge you to deal with this matter soon, Minister.
Thank you, Deputy Chambers. I take the point you make, and I would also reiterate the point that I made, that these appointments were made for a 24-month period. So we didn't have a scenario whereby people were sanctioned forevermore or for the rest of their career. These were appointments made initially for 24 months, considering what the then government decided was the particular and extraordinary circumstances in trying to get these hospital groups up and running. There is a serious issue, though, in the Irish Health Service in terms of making sure that we can attract and retain the appropriate level of management and indeed the appropriate level of clinician that we want. And I think this is something that I would really appreciate if the Oireachtas cross-party group on the 10-year plan is going to look at. If we want people to manage, I'm meeting hospital managers now and hospital group CEOs, and I'm looking into the whites of their eye and say, I need you to live within your budget. I need you to do this in relation to patient safety. I need to know that we have the calibre of people that is necessary to have, and I don't mean this in any disrespectful way to the people currently doing their jobs, but you will be aware that there was even difficulty in managing to find people to apply for the posts, and certainly in finding anybody to agree to take up the post. So these were the circumstances in which these individuals stepped up to the plate and are doing their very best, and in many cases doing a good job. But it's for a 24-month period, and it will be reviewed then.
Thank you very much. Before moving on